Matt. He's 4 years old, and he was diagnosed at 23 months old. He was diagnosed with rhabdomyosarcoma. It's a soft tissue cancer, and it was in his right cheek.
I was diagnosed with cancer a year and a half ago. I didn't want to believe it, first of all, because I didn't have any symptoms, so it was really a devastating blow to me when I found out that I had prostate cancer. And it took me a while to come to terms with it, actually.
I was diagnosed in February of this year, head and neck cancer. I had lymph nodes, my neck that wouldn't go down. I knew something wasn't right. How did I feel? Well, I had a brother. He died at 39 from cancer. And I don't know, I think I felt the worst, you know.
Normally, external beam radiation will often give very high doses of radiation to large volumes of normal tissue in trying to cover a tumor. Now, with proton beam therapy, we're able to really be in the mode of treating basically just the tumor and really reducing the dose to the surrounding normal tissues.
We decided the proton radiation was the best for him. We traveled to Warrensville up by Chicago. We were there for 7.5 weeks. That was by far one of the hardest things due to me having other children. On Thursdays through Sunday, my husband would travel to Chicago to be with us at the time. If we were able to be at home, it would have been a lot easier.
Yeah, I drove every day, 300 miles, round trip, between chemo and radiation. Everything started catching up to me, and people stepped up and really helped me. Because that's one thing about this whole, you look at life a lot different.
Once I did come to terms with it, I decided to take some action. I was able to sit down with a team, a nutritionist that explained dieting, my diet, and I had a urologist, and I had actually about 2 different radiologists that explained both sides, just so that I would have a complete understanding. And they explained the procedure thoroughly, and I really appreciated that. I had my brother with me too. He's older than me, and he was able to sit down just in case I didn't understand certain things. I had 4 ears actually.
Having a proton facility at OSF St. Francis would be a facility for all of downstate Illinois. Right now, trying to get patients treated with proton therapy, even when it's really critical for them, is a real problem because of the distances that people have to travel and the dislocation from their home residence, as well as all the issues involved with insurance coverage when patients are not in their usual care system.
I think having it here in Peoria would be amazing. My husband could have been able to come and help us, and the fact of being in our own home every night would have been a huge help for us.
I want to sleep in my own bed, watch my own TV, see my animals. Peoria never had proton. That'd be unbelievable. OSF could do a lot of good for people.
In general, the challenge is for all of us in the medical community to come together to create a place where patients feel safe in coming and knowing that they'll get good advice that's based on the thinking of all the specialists, not just the first one that they encounter, but it's about improving the health of the community, improving the health of our Tri-County area, and improving the health of downstate Illinois. To do that, we need to carry this on to the next step of building a comprehensive cancer center where patients are able to readily access all of the physicians and where the physicians want to come and practice and live in Peoria, Illinois, because all of these facilities are well organized and well put together, both in terms of equipment that's available and in terms of the way that people are handled professionally, getting the support that they need in order to live longer, more productive lives.
Just the benefits to so many people. Obviously, if people are traveling that far, there's some good being done there.
It was painful, but you know what? One thing about it, they made me as comfortable as they possibly could. They were very attentive to me. They made me feel like they cared.
Going through this experience has taught me and my family that you can't expect what's going to happen tomorrow. Now that we are at the 2-year mark of being cancer-free, he is full of energy, running around like a typical 4-year-old. If you looked at him now, you wouldn't have had a thought in your mind that he had cancer.